said, my name is Andrew Powell. I am actually a full-time firefighter in the neighboring community of Dracut. I've been a union guy for 20 years. I work at Boston Benefit Partners as a benefit consultant, sort of part-time, if you will. But my responsibilities at Boston Benefit Partners is solely to work with public sector unions in the municipal world. So I work with cities and towns through the affiliation of the Mass Teachers Association, the police, the fire, and so on, all over the Commonwealth, and have been doing that for now for 6 years. And so I have very intimate knowledge as to the pressures and the issues that we're facing as employees and retirees at the bargaining table, and also what city government is facing when it comes times to explore their budgets and what they can afford as well. So this presentation today is really not meant to make you an expert on the Group Insurance Commission. It is going to be the first of, if you decide to move forward, the first of many exposures to information about the GIC. The GIC is a very complex system and program. It provides health insurance, as you will see shortly, to several 100,000 people in the Commonwealth of Mass. This is just an introduction to that program because it is an option that exists. Cities and towns right now, as well as public employee unions and retirees, are all struggling with this healthcare cost issue that faces us every day. And the Group Insurance Commission is one of the options that many state legislators, state leaders, Taxpayers Foundation, the Mass Municipal Association is touting as the answer to all of our problems. Because the Group Insurance Commission tends to be, in most cases, lower cost in premium on all of their health plans than most city and towns can experience on their own. And that is true here in Methuen. It has been true for the several communities, the 21 cities and towns and regional school districts that have already negotiated their way into the Group Insurance Commission. Most recently, the city of Lawrence, which was mandated under the GIC as part of their financial relief bill. So the GIC is one of many options. There are other options out there. The city of Methuen has explored and implemented some of those options with the help of the unions, including last year adopting this health plan from Tufts that has an upfront deductible. A deductible, I'll just tell you, is not very common in the municipal sector, so Methuen is sort of a standout because you've done your due diligence, to borrow Donna's phrase, under the Public Employee Committee, the Section 19 model that you operate under. Your employees, your retirees are constantly working with the city government in ways to explore reducing healthcare costs. So let me walk you through exactly how the presentation will go tonight. And again, I'll try to answer all the questions you have as best I can at the end of the presentation. And then we will prepare a question-answer document to those questions that will also be posted on the Methuen Education Association's website. So tonight, and again, I apologize, you may not be able to read this from the back of the room. We're going to talk about sort of the problem that exists around us, which is healthcare costs and the trends and some of the cost drivers associated with that. Because it's really important for you to understand, why is this conversation happening? You have to understand that. So we'll talk about some of the costs. We will talk very briefly on some of the legislative approaches to deal with the healthcare crisis in Massachusetts. Then we'll get into the Group Insurance Commission, and we will talk about how they're structured. We'll talk about their health plan options. We'll look a little bit about their plans, some of their key components, their key co-payments, their key deductibles. We will do a brief comparison of your active employee non-Medicare plan, your Tufts plan, against one of the plans from the Group Insurance Commission. And then we'll talk about the process of how you, as a city, workers, retirees, and the city government move forward if you find the GIC to be an attractive option and actually negotiate the terms into the Group Insurance Commission, and then we'll do questions and answers. So let's talk a little bit about the problem here that's happening. Medical trend, that's a term that we consultant geeks work with all the time in the marketplace. Trend, that's the inflationary cost of healthcare. That is the price of the doctors, the hospitals, the laboratories, the services that you receive for your injuries and your illnesses, your diseases, and that's the rate that it inflates every year. Like the cost of milk goes up every year. The cost of health care goes up every year. And since 2008, all the way up to 2011, we've been right around the 10% mark. So every year, the cost of delivery of care goes up by about 10%. That does not say your premiums go up by 10%, but it has a direct effect on your premiums. So when trend is higher, premiums tend to go up higher as well. Okay? So that is certainly driving some of this discussion. Milk doesn't go up by 10% every year, but certainly healthcare costs are going up by 10% every year. And then the premiums are increasing on top of that for the administrative charges and to handle some of the extraordinary claims that we experience as a group. So this constant trend of 10%, unwavering, just means that that line of cost is continuing to rise, and there really is no end in sight. And the national healthcare reform that was recently passed by the federal government has no positive effect on this trend from what we can see. It actually has the opposite effect, whereby some of the reforms, the national healthcare reform, will actually increase our costs moving forward. We also are dealing with a recession right now. And this recession, coupled with high unemployment, has stressed budgets for both public sector and private sector employers. And everybody in this room works for a public sector employer. Revenues are down. Tax levies at Prop 2.5 limit the ability to collect taxes or raise taxes to pay for expenditures in city and town government. Unemployment, the recession, is having a major impact on the number, or excuse me, the total dollars that are available by any city or town, not just Methuen, but by any city and town out there, for its ability to pay for healthcare costs and all of the other administrative costs of doing business. And this last bullet is really interesting. This is from a very recent study that 5% of the population drive about 50% of our total claims. That's to say that 5 out of 100 people generate 50% of the dollars it takes to insure that group. They generate the most claims. It's a very small piece of the population if you think about it. Most of us are lucky enough not to have to go to the doctor on a regular basis, not to have frequent hospitalizations. But there is a population of people that drive most of our costs. What are some of the drivers that we have? Well, here in Massachusetts, we're very unique. One fact I didn't put up there is that the Massachusetts healthcare costs are the highest in the world. Massachusetts, we're lucky enough to live in a state that has the highest healthcare costs in the entire world. We have, however, access to some of arguably the best healthcare in all the world. We're right down the highway in Boston. We have some of the best teaching facilities in all of the world. And as a result, our healthcare costs are very, very high. But some of the other issues, or some of the other drivers of cost, is that our demand for healthcare services remains high. We're a very entitled society. We want it, and we want it now. And that's the same with healthcare. When we are feeling ill, we rush off to the doctor. If we need to have a surgery, an elective procedure, say an arthroscopic on the knee, we want it done now. We don't want to wait 5 months to have that procedure done. So our demand for healthcare is very, very high in this country. And again, it's not wavering. We are continuing to grow as a population. We're developing, and we are utilizing new and very expensive medical technologies. Here in Massachusetts, a very large part of our economy is driven by biotech and high-tech firms that are developing the latest and greatest medical technologies out there, and that comes with a price. And as you notice, we also have a very large number of pharmaceutical companies in the Commonwealth, and again, they are developing these high-cost new drugs. Very good for us, but they come at a very high price. So the price for medical services do continue to rise much faster than the price of goods and services. Healthcare is certainly outpacing inflation by all other goods and services. Now, this healthcare problem, as we're experiencing, has certainly resulted in a lot of rhetoric, especially against public employees. We can sit here in this room and admit that public employees have been sort of the target of a lot of the discussion around benefits and the cost of health care. And the legislature is responding to that. The legislature is responding to organizations like the Massachusetts Municipal Association and the Massachusetts Taxpayers Foundation and the Boston Municipal Research Bureau by filing legislation and turning up the rhetoric that health insurance costs are unsustainable for city and town government, and there has to be some change in that realm. And for the last few years, we've seen legislative proposals that would essentially shift much of the healthcare costs borne by our employers, the cities and towns, onto the employees and the retirees. All of the proposals have one thing in common. It does just that. It shifts costs. It doesn't really address the real issue, which is the price of the care in the first place. We're luckily now beginning to see also the government responding in that realm as well. The carriers are getting involved in that, and you'll see a little bit about that with the Group Insurance Commission's quality initiative. But the latest governor's proposal is asking the legislature to allow the government to assign an actuarial value, that is a value of a plan at the Group Insurance Commission, and use that as a benchmark for all other city and town plans in the municipal sector to meet. Now, I began by saying the GIC, the Group Insurance Commission plans, tend to be less costly than our city and town health plans. And if the state government is setting a benchmark at a GIC plan that is lower in cost, what the proposal by the governor could mean is that every city and town in Massachusetts would have to shift more cost in order to align their value with the GIC. That's how the proposal reads. It's still in the very early stages of being debated at Beacon Hill. The labor leaders, as well as the business community, the carriers, they're all involved in the conversation around this legislation, so it's much too early to know how that's all going to flush out. But to keep your eye on the ball, I'll say that as a union person to employees and retirees in the room, keep watching this, because it could certainly dramatically affect our collective bargaining rights, and as well as the types of costs that we are exposed to.